Okay, so today we're going to be diving deep
Yeah.
into a topic that's, pretty sensitive
Yeah.
and also incredibly important, and that
Yeah.
is trying to conceive after experiencing a miscarriage.
Mm-hmm.
And our guide for this journey is going to be a blog post
Okay.
by a woman named Caroline.
Okay.
She is a medical secretary
Interesting.
and child care specialist.
Wow.
The name of the post is
Okay.
Swanger of New Proberen na in Miskram,
Wow.
which I believe translates to something like pregnant, trying again after a miscarriage.
Yes, that's right.
And this post is from her blog called Leafs Caroline.
Cool.
So we're really going to kind of dig into her
Yeah.
personal experiences and insights,
Great.
and then kind of, pair that with your
Yeah.
expertise so we
That's
can
yeah.
kind of understand this,
Yeah.
pretty complex landscape.
Yeah, it's definitely a journey
Yeah.
that I think calls for, strength
Yeah.
and a lot of understanding. And, Caroline really, she doesn't shy away from that at all in her writing.
Yeah.
She really emphasizes the emotional roller coaster
Yeah.
that can come with trying to conceive after you've experienced a loss.
I think that was
Yeah.
one of the things that struck me as well, is
Yeah.
just her honesty
Yeah.
about this
Yeah.
wave of emotions that
Yeah.
you might be going through,
Mm.
sadness, disappointment,
Right.
maybe even guilt.
Absolutely.
And she doesn't, pretend it's easy.
Yeah.
And I think that honesty is so important
Mm-hmm.
for anyone that's going through this.
Absolutely. And I think acknowledging those feelings,
Mm-hmm.
allowing yourself to grieve
Yeah.
is absolutely crucial.
Yeah.
It's almost like laying the groundwork for healing,
Yeah.
both individually but also as a couple.
Yeah.
And I think that skipping that step
Right.
can really have an impact down the line,
Yeah.
not just on your, emotional well-being, but also on your relationship dynamics.
Yeah. It makes me think about those old sayings. Like,
Yeah.
you have to face your demons
Mhm.
before you can move on.
Right.
I wonder, are there specific things that people can do
That's a really good point.
to work through that grief?
Yeah.
Because it's one thing to say,
Mhm.
allow yourself to grieve, but
It can feel very abstract, right?
yeah, it's another to actually do it.
One thing that Caroline suggests,
Mhm.
and I often recommend this to my patients as well,
Okay.
is finding a good therapist,
Okay.
someone who specializes in grief and loss,
Yeah.
especially in the context of pregnancy and miscarriage.
So it's not just about
Yeah.
talking to anyone. It's about finding the right
Yes.
support system.
Yes, and that support system might include your partner,
Mhm.
close friends, family members,
Mhm.
but a therapist can really provide tools and strategies to help you work through those complex emotions
Okay.
in a way that, even people with the best intentions might not be equipped to do.
Yeah. And Caroline,
Mm.
she also talks a lot about communication,
Yes.
particularly with your partner.
Right.
And she stresses that deciding to try again to conceive
Mm-hmm.
needs to be a joint decision,
Absolutely.
not just something that one person pushes for.
Yeah. And I think that's actually another area where a therapist can be really helpful for couples.
Okay.
They can actually help facilitate
Right
those
there.
conversations, help both partners
Mhm.
articulate their, feelings, their fears,
Yeah.
make sure you're truly on the same page,
Yeah.
both emotionally and logistically.
Okay.
Because even if you both agree,
Yeah.
let's try again,
Right.
there might be differences in your timelines or your comfort levels.
Yeah. She doesn't just say, talk to your partner.
Mm.
She really digs into the nuances
Yeah.
of that conversation.
Yeah.
You need to be honest,
Hmm.
to listen,
Yeah.
and to respect each other's feelings,
Ab-
even if they're different.
It's like building a bridge of understanding
Yeah.
between two people who are both going through a really intense experience.
Yeah.
And sometimes you need a guide
Yeah.
to help you construct that bridge properly.
Yeah. And, alongside therapy and open
Yeah.
communication,
Mm-hmm.
Caroline also mentions consulting with a doctor
Right.
before trying again.
And this is really where the medical expertise comes in.
Yeah.
It's not just about getting the okay.
Right.
It's about really understanding your individual situation.
Yeah.
What happened, what
Yeah.
might need to be considered moving forward.
So it's more than just a checkup.
Exactly.
It's about getting informed and feeling empowered
Right.
to make the best choices
Mm.
for your health and
Your
future pregnancy.
Yeah, for example, your doctor might recommend specific blood tests
Okay.
to check your hormone levels,
Mm-hmm.
like FSH and LH, which play a key role in ovulation. They might also suggest an ultrasound to examine the thickness of your uterine lining, which is crucial for implantation.
That's really helpful to know.
Yeah.
Because I think when you're going through something like this, it's easy to feel powerless.
Right.
But having that information, understanding, what tests are available and why they're important can really shift that dynamic.
It's about asking questions.
Yeah.
Not being afraid to advocate for yourself. Right. Your doctor is there to guide you, but ultimately you are the one making decisions about your body and your reproductive journey.
So Carol Ann also talks about the importance of physical health.
Yes.
And how that plays into trying to conceive.
Absolutely.
And she focuses on diet and exercise.
Right.
Which might seem obvious.
Yeah.
But I think it's easy to let those things slip when you're dealing with so much emotionally.
And what's interesting is that exercise, especially moderate intensity activities like brisk walking or swimming, can actually have a positive impact on hormone regulation.
Interesting.
Which is, particularly relevant after a miscarriage.
So it's not just about being physically fit. It's about creating the optimal hormonal environment for a potential pregnancy.
And exercise also helps manage cortisol.
Okay.
Which is the stress hormone.
Right.
And cortisol levels can often be elevated after a miscarriage.
Makes sense.
So reducing stress through exercise can really help create a more balanced internal environment that's conducive to conception.
So it's like a two-pronged approach.
Yeah.
Physical and emotional benefits kind of working together. And then she mentions diet as well.
Right.
Which I imagine kind of plays a similar role.
A balanced diet, rich in fruits and vegetables and whole grains, provides all those essential nutrients that your body needs to function optimally, including those involved in reproductive health.
So it sounds like there's a lot you can actively do.
There is.
To prepare your body for a potential pregnancy.
And I think that sense of agency can be really empowering.
Yeah.
But I think it's also important to acknowledge that even with all the preparation in the world, there's still a level of uncertainty that's inherent in this journey.
Absolutely.
And that's something that Carol Ann addresses beautifully in her blog.
She talks about embracing vulnerability and accepting that trying to conceive after a miscarriage is an emotional roller coaster.
Yeah.
And she's very open about the fact that not every attempt will be successful, which I think is so important to hear.
I completely agree.
Yeah.
It's about acknowledging that you can do everything right and still not get the outcome that you're hoping for. And that's incredibly difficult to come to terms with.
It's a reminder that we're not in complete control.
Yeah.
And that can be scary. But it's also a reality we need to face.
And that's where self-compassion becomes so crucial. It's about being kind to yourself, allowing yourself to feel the full range of emotions, and recognizing that this is a marathon, not a sprint.
So instead of beating yourself up if things don't go as planned, it's about offering yourself that same support and understanding that you would offer a friend going through the same thing.
And it's about celebrating the small victories along the way, acknowledging your strength, your resilience, and recognizing that you're doing the best you can in a very challenging situation.
And that brings us back to the idea of building a strong support system.
Absolutely.
Because while self-compassion is essential, having those external sources of support, whether it's a therapist, your partner, friends, family, can make a world of difference.
It's like weaving a safety net of empathy and understanding around yourself so that when those inevitable challenges arise, you have a soft place to land.
That's a beautiful analogy.
Thank you.
I think it speaks to the power of human connection.
Absolutely.
Especially during those difficult times.
And within that network of support, open and honest communication with your partner remains paramount.
Yeah.
It's about creating a safe space where both of you can express your fears, hopes, anxieties without judgment.
So it's not just about making decisions together.
Exactly.
It's about being there for each other. Emotionally.
Throughout the entire process.
Throughout the entire process.
Precisely. It's about remembering that you're a team navigating this challenging terrain together. And sometimes you might need to call in a guide, like a therapist, to help you navigate particularly tricky stretches of the path.
Which makes me think about the role
Yeah.
of medical professionals
Yeah.
in all of this.
Yeah.
We've talked about the emotional and psychological aspects,
Right.
but I'm curious to delve a little bit deeper into
Okay.
the medical side of things.
Let's explore that further.
So we've talked about, the importance of seeing a doctor
Right.
before trying to conceive again.
Mm-hmm.
But what exactly does that look like?
Well,
What kind of tests or procedures might be involved?
it really depends on your individual situation and your medical history.
Okay.
But let's say, for instance, that there were complications with your previous miscarriage, like an infection or a retained placenta.
Got it.
Your doctor would definitely want to make sure that those issues had been fully addressed. Right.
Before you try again.
So it's not just about preparing for a new pregnancy. It's also about making sure that any lingering health concerns from the previous one have been taken care of.
And then, depending on your age and medical history, there might be some additional tests to consider.
Okay.
For example, if you're over 35, your doctor might recommend genetic testing to assess the risk of chromosomal abnormalities.
I know that's something that a lot of women are offered during pregnancy, but it sounds like it might be even more relevant.
It can be.
After a miscarriage.
Especially if there's a history of recurrent miscarriages.
Okay.
Or if there's reason to suspect that a genetic factor might have contributed to the previous loss.
Got it.
It's about gathering as much information as possible
Yeah.
to make informed decisions moving forward.
And speaking of information,
Caroline also mentions the importance of understanding your cycle, tracking your ovulation, and being aware of your fertile window.
That's a crucial piece of the puzzle.
Yeah.
Regardless of whether you've experienced a miscarriage or not.
Right.
But it can feel even more important after a loss.
Yeah.
As you're often eager to conceive again as quickly as possible.
And there are so many tools and apps available these days.
Absolutely.
Help with that tracking, right?
There are ovulation predictor kits.
Yeah.
That measure hormone levels in your urine.
Okay.
There are fertility monitors that track your basal body temperature.
Okay.
And then there's a whole array of apps
that
kind of combine those data points to give you a more comprehensive picture of your cycle.
So it's about taking an active role
Exactly.
in understanding your body's rhythms and using those tools to your advantage.
And it's not just about knowing when you're ovulating.
Right.
It's also about understanding the changes that occur throughout your cycle.
Okay.
So your cervical mucus, for example, changes consistency depending on where you are in your cycle. And those changes can be a really good indicator of your fertile window.
I know a lot of women feel uncomfortable talking about these things.
I know.
But it sounds like being aware of those physical changes
can be
really empowering.
It absolutely can.
Yeah.
It's about getting to know your body on a deeper level.
Yeah.
And understanding this intricate dance of hormones and physiological processes that make conception possible.
And speaking of hormones, I remember Caroline mentioning something about specific vitamins and supplements that could be helpful when trying to conceive.
She specifically recommends prenatal vitamins,
Okay.
which are packed with essential nutrients like folic acid, iron, and calcium.
Okay.
And folic acid in particular is crucial for preventing neural tube defects in the developing baby. So it's recommended to start taking it at least a month before you start trying to conceive.
So it's not just about supporting your own health. It's also about setting the stage for a healthy pregnancy from the very beginning.
And your doctor might recommend additional supplements based on your individual needs.
Okay.
So for example, if you have low iron levels, they might suggest an iron supplement to boost your red blood cell production.
It's like fine-tuning your body's engine to make sure it's running smoothly before embarking on this journey.
And while medical guidance and physical preparation are essential, we can't forget about the emotional side of things. Caroline talks a lot about the emotional roller coaster of trying to conceive, especially after a loss.
And she emphasizes the importance of self-compassion, which we talked about earlier.
Yeah.
But are there any other specific coping mechanisms or strategies?
One thing that I find incredibly helpful for managing anxiety and stress is mindfulness.
Okay.
So practices like meditation, deep breathing exercises, or even just spending time in nature can really help to calm the nervous system and bring a sense of peace amidst the uncertainty.
It's like creating a little pocket of stillness within yourself, a place where you can go to find grounding when things feel overwhelming.
And it doesn't have to be anything elaborate. Even just 5 minutes of focused breathing can make a difference. Another strategy that I often recommend is journaling. Writing down your thoughts and feelings can be incredibly cathartic. It allows you to process those emotions without judgment and to track patterns over time, which can be really insightful.
It's like having a conversation with yourself on paper.
Exactly.
Giving those swirling thoughts a place to land and just making sense of the chaos.
And sometimes just the act of putting pen to paper can be incredibly therapeutic. It can help you identify what's triggering your anxiety, what you're grateful for, and what you need more support with.
It's like shining a light on those hidden corners of your mind. Bringing awareness to the things that might be fueling your stress or anxiety.
And sometimes those insights can be enough to shift your perspective or help you identify areas where you need to set boundaries or ask for help.
Which brings us back to the importance of that support system. Caroline talks about connecting with others who've gone through similar experiences. And I think that sense of shared understanding can be incredibly powerful.
It absolutely can be. Whether it's a formal support group or online forums or even just a close friend who's been through something similar, having that space to share your story and hear from others who understand can be incredibly validating.
It's like knowing you're not alone in the wilderness, that there are other people out there navigating a similar terrain.
And within that network of support, open and honest communication with your partner remains essential. It's about creating a space where both of you can express your fears, hopes, anxieties without judgment.
So it's not just about making decisions together.
Exactly.
It's about being there for each other emotionally throughout the entire process.
Precisely. It's about remembering that you're a team.
Navigating this challenging terrain together. And sometimes you might need to call in a guide, like a therapist, to help you navigate particularly tricky stretches of the path.
Which makes me think about the role of medical professionals in all of this. We've talked about the emotional and psychological aspects, but I'm curious to delve a little deeper into the medical side of things.
Let's explore that further.
We've really covered so much from, the emotional weight of trying to conceive after miscarriage to, the importance of medical guidance.
Absolutely.
And building that strong support system. But before we wrap up, I want to kind of circle back to something that Caroline said that really resonated with me. She talks about how even with all the preparation and the knowledge, there's still this element of surrender involved.
That's such a powerful observation.
And I think it speaks to the fact that ultimately we're not in complete control of our bodies or our reproductive journeys.
And that can be a really difficult thing to accept.
Absolutely.
Especially when you've already experienced the loss of a pregnancy.
And that's where I think the concept of surrender comes in. It's not about giving up or losing hope, but it's about acknowledging the limits of our control and accepting that some things are simply beyond our grasp.
It makes me think about that saying, like, let go and let God. And even if you're not spiritual, I think that underlying message can still apply. It's about, releasing that need to micromanage every aspect of the process. And trusting that even in the uncertainty, there's this wisdom at work.
I love that.
That we may not fully understand.
That's a beautiful way to put it. And it's not easy by any means. Letting go of control can be terrifying, especially when you've already experienced the heartbreak of a miscarriage. But I truly believe that embracing that surrender, that willingness to ride the waves of uncertainty can actually create more space for peace and acceptance, regardless of the outcome.
It's like allowing yourself to be carried by the current instead of constantly fighting against it.
Yes.
And in that surrender,
there
might be a sense of liberation.
Absolutely.
Even amidst the challenges.
I couldn't agree more.
Yeah.
And I think that's such a powerful message to leave our listener with today.
Yeah.
As you move forward on this journey, remember that it's okay to feel all the feels.
Yeah.
It's okay to grieve, to hope, to fear, to doubt. And it's also okay to surrender.
Yeah.
To trust the process and to believe that even in the unknown, there's a strength within you that will carry you through.
And I think Carolina's story, with all of its vulnerability and honesty, really exemplifies that strength.
It does.
She shows us that it's possible to navigate this challenging terrain with grace, resilience, and a deep sense of self-compassion.
And as we wrap up our deep dive into her blog post, I want to pose one final question to our listener.
Okay.
What small step can you take today to prioritize your emotional well-being on this journey? It doesn't have to be anything grand, just a tiny act of self-care that honors your strength and resilience.
Yeah, that's a wonderful way to end our conversation. A gentle reminder that we have the power to nurture ourselves, to seek support, and to really embrace this journey.
Absolutely.
One step at a time.
One step at a time.
Thank you for joining us.
Thank you.
On this deep dive.